In this video, we are talking about 10 signs of low estrogen and why they matter. Whether you are a woman or a man, I believe you would benefit from the information in this video. Number 1, hot flashes and night sweats. Women experiencing hot flashes often describe it as a sudden wave of heat rushing through their body, like their face and chest are on fire. And often, this heat is followed by chills and sweating. Normally, estrogen helps your brain control your body temperature. It tells your blood vessels when to expand and when to contract, which keeps your body temperature steady. But when estrogen drops, the thermostat of your body, the hypothalamus, becomes overly sensitive. Even the smallest change in temperature can make your body think it's overheating. This triggers a hot flash or night sweats as the body tries to cool you down. You might suddenly feel a wave of heat or wake up in the middle of sleep covered in sweat. Some women might say, I'm freezing in the morning, but sweating all night. This makes them very uncomfortable and makes it difficult to sleep. 2. Mood swings and irritability. Women with low estrogen often notice that their mood changes very easily, crying for no reason, snapping at colleagues and loved ones, and feeling anxious without knowing why. Normally, estrogen helps your brain control chemicals like dopamine and serotonin, which are responsible for your mood, motivation, and emotional stability. When estrogen drops, these hormones fluctuate very rapidly and frequently, and your emotional filter becomes weak. You may start to experience mood swings and become more irritable than usual. If you already have mood disorders like anxiety and depression, these changes can make your symptoms even worse. Trust me, it's not all in your head. It's your brain responding to frequent hormonal changes. 3. Brain fog and memory problems. If you have low estrogen, you might find yourself forgetting names, frequently losing your train of thought, or walk into a room and forget why you are there. Normally, estrogen helps the brain with attention, focus, and mental clarity. It improves blood flow to the brain, helps brain cells communicate, and protect against stress-related chemical changes. When estrogen levels drop in the body, you may notice that your thoughts feel foggy or scattered. Women with attention problems like ADHD often find these changes even more noticeable. In fact, there's research coming out showing that there are more women in their 40s and 50s being newly diagnosed with ADHD because hormonal changes make attention problems become more noticeable. 4. Vaginal dryness and painful intercourse. Many women notice burning, itching, or pain during sexual activities, or a feeling of dryness even when they're not sexually active. This is because estrogen keeps vaginal tissue thick, elastic, and well lubricated by keeping a healthy blood circulation to the vagina and keeping it moist. With low estrogen, the vaginal tissue becomes thinner and drier. This is a condition called vaginal atrophy. This can lead to discomfort, itching, and some women might even develop small tears on their vaginal tissue. It's not just about intimacy. This can affect a woman's daily comfort and even her confidence. Number 5, irregular or missed periods. As estrogen starts to decline in perimenopause, menstrual cycles can become very unpredictable. They can become shorter, longer, heavier, and they might not even come at all. Under normal conditions, estrogen helps prepare the uterine lining for your period, and then it coordinates with progesterone to keep your cycles regular. But when estrogen drops, your cycles become less consistent and eventually stop completely during menopause. This change can also come with PMS-like symptoms such as cramping, bloating, or breast tenderness. Even if your period doesn't come, you can still experience these. Number 6. Weight gain, especially around the belly. Many women notice that no matter how healthy they eat or how often they exercise, belly fat becomes harder to lose. This is because estrogen controls fat distribution. It encourages fat storage in areas like the hips and thighs, and it helps maintain lean muscle. When estrogen drops, fat tends to move towards the abdomen, the stomach. This is why for a lot of women, losing weight starts to feel harder even when your lifestyle habits have not changed at all. Stress, poor sleep, and thyroid problems can make this even worse. by raising your cortisol levels. Cortisol is a hormone that is involved in storing fat. So when the level of cortisol rises, it becomes very hard to lose belly fat. Number 7, joint pain, stiffness, and weak bones. Women with low estrogen might wake up feeling sore or notice the joints quick more than they used to. Normally, estrogen protects bone density by helping your body absorb calcium and slowing down the breakdown of bones. Estrogen also helps keep the cartilage and the connective tissue in your joints hydrated and flexible. When estrogen drops, bones can gradually become weaker and more fragile. They become easy to break, which increases the risk of osteoporosis and fractures from falls. In addition to that, lower levels of estrogen in the body means less protection for the joint cartilage. So you may feel stiffness, tenderness, or swelling, especially in your knees, hips, and hands. A vitamin D deficiency or an existing condition like arthritis can make these symptoms worse, or they can make them appear sooner. Number 8, thinning of hair and skin dryness. Women with low estrogen might notice their hair is shedding more in the shower, or their skin is feeling dry, itchy, and dull. This is because estrogen protects the skin by keeping it thick, hydrated, and elastic. Estrogen also supports strong, healthy hair growth by improving blood flow to the scalp. When estrogen levels drop, hair can become thin or fall out, especially around the crown and hairline. The skin can lose collagen and moisture, leading to fine lines, wrinkles, or sagging of the skin. This is when a lot of women start to look older than their age. The most noticeable changes on the skin usually appear on the face, the neck, chest, hands, and forearms, where the skin naturally becomes thinner with age. Women with thyroid problems, nutrient problems, or chronic stress may see these changes sooner or more intense. Number 9, decreased sex drive or low libido. Many women describe losing interest in sex or just feeling disconnected from desire. They just don't feel like doing it. This can happen even in healthy relationships. So estrogen supports sexual health by increasing blood flow and sensitivity to the pelvic area. Estrogen is also responsible for stimulating the area in the brain that is responsible for pleasure and connections. When estrogen drops, sexual arousal can take longer and natural lubrication can decrease, making intimacy or sexual activities uncomfortable and less enjoyable. This can affect a woman's self-esteem and emotional closeness, which is why addressing hormone health is so important. Number 10, heart palpitations and increased cardiovascular risk. Some women with low estrogen describe feeling like their heart is skipping a beat, or as if their heart is racing for no reason. Under normal condition, estrogen helps keep blood vessels flexible, lowers inflammation in the body, and maintain healthy cholesterol levels, all of which protect your heart over time. But when estrogen drops, blood vessels become stiff, the level of cholesterol in the body may rise, and heart rhythms can become more irregular. This is why some women notice heart palpitations or fluttering sensation in their chest. Over time, this hormonal shift can increase the risk of heart disease, especially in women with high blood pressure, diabetes, or a family history of heart problems. So even if symptoms feel mild, it is always important to check in with your healthcare provider for proper evaluation. Number 11, which is a bonus symptom, fatigue, low energy, and lack of sleep. Estrogen helps your body produce energy efficiently. It also keeps hormones like cortisol and melatonin in balance. These two hormones affect our sleep and awake cycle. So when your estrogen drops, your sleep can suffer. You may have trouble falling asleep, staying asleep, or even waking up early and not being able to go back to sleep. Some women describe it as feeling tired but wired. Their body is exhausted, but their mind won't shut off. The next day, you might feel exhausted, like you're moving through mud or running on an empty tank. This can make even the simplest tasks feel so hard to complete. Things like cleaning, cooking, or even getting through work become very difficult. And this kind of fatigue can feel even worse if you're dealing with mood disorders like depression, anxiety, and other medical conditions that cause fatigue. And when you're not sleeping well, symptoms like brain fog and mood changes can become even worse, creating a vicious and frustrating cycle of low energy and chronic fatigue. It is important to remember, experiencing one or more of these symptoms does not automatically mean you have low estrogen. Other conditions like thyroid problems, diabetes, certain medications, depression, anxiety, or nutritional deficiencies can either cause or worsen the same symptoms we just talked about. So always seek medical advice, proper evaluation, and diagnosis before starting any treatment. Don't go buying vitamins and herbs from Amazon before talking to your doctor and being evaluated and diagnosed properly. Whether you are in perimenopause, menopause, or postmenopause, understanding these symptoms can help you recognize what your body is trying to communicate to you. The sooner you know, the sooner you can take proper action. If this video was helpful, don't forget to like it. Comment down below if you're experiencing any of the symptoms above. Also, don't forget to share this video because there's another woman out there that might be needing to watch this. For more videos like this, don't forget to subscribe to my channel and turn on the notification button so you do not miss anything. As always, thank you for being here. Thank you for watching this video till the end, and I'll see you next time. Ciao!